how are addiction and eating disorders connected? I would say a better question is, how are they not?
Yes. Same thing I was thinking.
Yeah, I mean, in so many ways. You could look at it in terms of root causes, which is where I go to first. So they share root causes, but also I think because I know so many people who will be watching this are yoga teachers and yoga therapists. Also, they go hand in hand. So they share a set of causes. And also, if you've got somebody with an eating disorder, chances are that if they haven't already, at some point they will struggle with substance abuse. And we've got a lot of research on that. And vice versa. Often you see with folks who struggle with addiction, if they haven't already or aren't already actively struggling with an eating disorder, as they get into sobriety, as they get into recovery, what do you see happen? But their relationship with food goes awry.
Which is exactly what happened with me, right? Once I got clean from substance abuse disorder, then my disordered eating went to a level that I hadn't even imagined, right? In addiction, we talk about this a lot. We will often play whack-a-mole, right? You whack one mole down, then the other one pops up, and another one, and it goes on and on and on and on until we address what's underlying the whole thing. Those are, again, we say symptoms. They're manifestations. There's something else going on. And in the recognition, as we know, that really it's treated very differently. There's a lot of similarity and the recognition that there's also a lot of difference.
Yeah, I'm glad you brought that up because we've just produced a huge event on this, which you can also find on Give Back Yoga University. I'm kidding. We've done the reason that Nikki and I came together to do a symposium on addiction and eating disorders is because we know they go hand in hand, but also we've had so many conversations about this difference in how they manifest and how they're treated. So one of the I think dangers with a lot of yoga teachers and yoga therapists is that they assume that they're the same thing. So you'll hear, oh, well, eating disorders are just another form of addiction. And there's a truth to that, but it's so oversimplified.
Right.
Especially for when you get into more severe manifestations of substance abuse and more severe manifestations of eating disorders, you're dealing with a whole different set of symptoms, of negative impacts. And I also hear from folks with eating disorders that find their way into a 12-step meeting and might be hearing things in those 12-step meetings that are actively harmful. So especially those who are maybe in bodies of larger sizes or dealing with emotional eating, there can sometimes be a really rigid way of, okay, well, no white sugar and no white flour. And of course, that can sometimes just exacerbate the very issue they came in with, which is...
And so for yoga teachers and therapists and people who may be viewing this, the whole idea is holding that there is this and. Yes. At the roots, it really is addiction, and there's this whole other aspect in working with that manifestation that are distinct from other forms of manifestation of addiction.
Yeah, I think also it's so important because one of the beautiful things about yoga is that often people come to yoga seeking some form of healing, and sometimes they're expressive about that, and sometimes it's kind of in the background. So they may say, "Oh, I'm coming here to stretch." But I think for you as a yoga teacher and yoga therapist, it's important to remember that if somebody comes to the yoga practice and they're saying, well, I'm in early sobriety, or I've been drinking too much and I'm trying to, change my relationship with alcohol, or whatever those are, keep in mind that these two things go hand in hand. So if you're hearing a lot of, oh man, I've been going to classes and the weight's coming off and I'm feeling better about my body, just be mindful that these two things often live in the same person. So you don't want to go, oh, you're looking so thin today, all of that, because you very well could be adding fuel to the other disorder. Or vice versa with somebody who's coming to recover from an eating disorder. You don't want to be like, hey, come out for drinks and let's go partying. Because again, the awareness to have is these two things, I think a lot of our populations at Give Back Yoga overlap, but man, these two are really connected.
It's very true. And I love the point you just made relative to that, because you see those kinds of things happening, particularly in social situations. And so that's something to just be careful with and to be aware of. Yeah.
Yeah. Nikki, we didn't say much about root causes, and I think because you and I have conversations all the time, we sort of assume. But if someone is listening and they're like, well, what do you mean they have the same root causes? How would you explain that?
It was talking about this earlier. The way that I love the definition that we use a lot relative to addiction in the work that I do in the world is addiction at its roots is the disease of the lost self. And that anytime I look outside of myself for something that can only come from the inside, you can be in really an addictive relationship with anything, including food. I usually say I've been in an addictive relationship with Nordstrom's, right? Because because I want this and I think it's going to complete me, right? And or if I'm just this size, then all the world is going to be mine, right? I'm always looking for something outside of myself. And so I assert that really at its root is this tendency, right, to just search outside of myself for something that can never be found outside of myself.
Yeah, I agree. And then you get into the disorder and it gets rooted, and you've got biological, psychological, all of these patterns and some
Changes
scars.
everything.
Yeah.
Yeah. Yeah.
I guess I'll also mention we talked about the path to healing being different, but there also, I guess I'd be remiss not to mention there are some things in the path to healing that are similar, that are the same, that are useful in both. So what immediately comes to mind, especially if you're a yoga teacher, a yoga therapist, is, the practice of becoming more aware of what's happening inside the body. So coming back to the self, coming
That's
into the
right.
body, of building interoceptive awareness, noticing hunger and fullness signals, noticing when your heart is racing, noticing when you're feeling tired and
felt
overwhelmed.
sense.
Yeah,
Yeah.
that's going to be useful for
Yeah.
both illnesses.
That's right. That's right. That's right. We talk about this process, and we've spoken this word before about titration, right? That it's a step-by-step walk back to reclaiming myself, right? Reclaiming myself. And so that is going to be useful at a root for both populations.
Yeah.
Yeah.
We're back to this thing we always come to. It's the yes and. So they're
Yes.
connected and they're different. The path to healing and recovery looks different, and there's some similarities and there's some tools that will be useful for everyone.
Yay.